Donnie, Jan, thank you so much for inviting me into your home to have the chance to talk with you about your journey with ALS. What kind of advice would you give someone like me in fairly early stages of planning for issues related to respiratory issues? What should I be thinking about? What should I be weighing? What choices am I going to be facing?
Well, certainly, you're going to get all of the assessment done each quarter at your clinic, and so following that, keeping track of it, you really need to be willing to embrace the technology that you have that's offered to you. You need to not really fight it, but see how you can work with it to make it work for you. And everybody's different. Everybody progresses at a different rate. And because of my seeming to be the last symptom onset is my bulbar, I'm able to manage the sip and puff. People that have more nerve damage in their throats may not be able to use the sip and puff, may have to wear their mask all day long. Or if they don't like that because they can't communicate or it's uncomfortable or whatever, there are other alternatives like a nose pillows or a Dreamweaver mask, which doesn't go up over the nose. And so it's really a matter of being open to, like say, embracing the technology.
What are some of your greatest concerns in terms of caregiving with the respiratory technology?
One of my big concerns is if something happens to him and I'm not here, or if something happens to him and I'm not able to help him or to advocate for him or to answer questions and talk with emergency personnel, I need to know that they're going to know what to do. And so one of the things we've talked about is we get a hold of our local fire department and talk with them about, if we called 911, I can give them a code for the front door so they don't have to break the door down. They need to know that he has ALS and that his lungs are healthy, but his diaphragm is gone. And so he can't move air in and out.
We have a bracelet.
Yeah, he has a medical alert bracelet on that says, respiratory onset ALS, I require mechanical assistance for breathing, beg me. But we've talked about what else can we do besides just that medical bracelet. We need something so that the fire department and EMT 911 would know if somebody comes to this address, what specific support he needs.
What to expect.
And we even know, we actually even want him to go to a specific hospital because we want him to go to the hospital where the ALS clinic is, because the respiratory people there have a little bit more awareness of ALS and what an ALS patient needs, and we want to make sure he gets the right care.
I also add in there that from my standpoint, being able to alert Jan, to wake Jan up in the middle of the night if I'm having breathing issues. And so we've got an alarm that's
Really
I can
loud.
move my hand over and hit. And we also use that during the day. I can she can put it in her pocket, go out, work in the yard, and I can use my eyes on my computer to alarm her.
But we also know that alarm is not 100% perfect. And so no matter what I'm doing, I'm always circling back in and making eye contact with him. Sometimes I'm out in the front yard and just looking through the front window at him. Other times I actually just make a point of I go out, I do something, I come back to get something in here, to say hi to him, I go back out, I just keep circling back because we can't just rely on an alarm.
No matter what, it's a risk.
Yeah.
And we
we know that.
We've chose to live with that risk.
With respiratory issues and respiratory technology, the message that you're conveying is that you have to be mindful of it all the time.
Yes.
It's not something you can walk away from and not pay attention to. That really sounds exhausting over the long term for both of you. How do you work with?
You grow into it, though. You don't have to know it all at once. So.
And do you have help come in to give you a break?
Yeah. We have family members that come over. We have some friends that come over. And we have it set up that once a week somebody comes over and I get to take off for a few hours and do what I want to do.
You two are living with this technology and the risks of the technology as well as the benefits 24/7, so you're
Yeah.
experts in it. When you do ask family members and friends to assist, how long does it take for them to get up to speed on what needs to be done with each piece of technology and each scenario that could go wrong?
Well, we've got a pretty small group of people, probably about 6 or 7 altogether, that I would actually trust them to be alone with Donnie. And
Well, we show them,
we always show them the equipment that he's using. They know how to change the batteries. They know where the backup is. They know where the cough assist machine is if he were to choke or have trouble swallowing or aspirate.
I've eaten, and they're here for the last,
Right, yeah.
the bulk of the
we
afternoon.
can choose our
and,
times.
you know, so I'm not doing anything risky like eating, you know, that might cause me to choke. So we try and not put that burden on them.
Yeah. We've talked about, like, what if something happened to me? And that's actually our biggest
No,
concern,
that is
because the people that come and help us do so in the middle of the day when his care needs are not great. And his sister has come and knows most of your nighttime routine.
She's a nurse.
Yeah, she's a retired nurse, but nobody knows the whole morning routine and nobody knows the whole nighttime routine. So, and the boys have all said, if you need us to, we will step in and we will do that. We'll do anything. And we believe them. But yeah, if something were to happen to me, like if I got really sick with the flu or something like that, we've talked about how I'm the strongest link in his care plan and I'm the weakest link in his care plan.
It's beyond just, you know, the having the support. It's really a lot of things. It's the clinic and the support you get from the clinic and the doctors. It's the therapy, you know. It's the attitude that all of that plays together in being able to manage these things.
Thank you so much for the time you spent with me.
Sure.
Thank you.
You're welcome. Happy to do it.